Hello, colleagues. My name is Ryan Burke, and I am a member of the FIP Pharmacy Technician Advisory Committee. The FIP Pharmacy Technician Advisory Committee was launched in Abu Dhabi in 2019, and is comprised of FIP stakeholders together with influential external organizations and individuals. We have recently established 4 work streams to support our goal to provide guidance and advice for leadership activities associated with the global development of the pharmacy support workforce, integrated with the FIP workforce mission. Today's digital event was organized by the Pharmacy Technician Advisory Committee Events and Symposia Work Group. I'd like to welcome you to our webinar, Pharmacy Technician Research, Highlighting Recent Literature. I am so pleased that we have an opportunity to showcase the growing body of research and evidence around pharmacy technicians and the pharmacy support workforce. As you know, pharmacy technicians have a critical role in the delivery of healthcare and patient care services. And today, we'll offer an overview of current research and publications about pharmacy technicians' contributions. Our excellent speakers will also discuss the importance of data, evidence, and research related to pharmacy technician practice, and describe current literature that demonstrates the value of the pharmacy support workforce. I will be your moderator for the first half of today's event, and my colleague, Lynn Fogerty, will take over about halfway through. I currently serve as Director of Professional Affairs at the Pharmacy Technician Certification Board in the United States. I am a pharmacist by training, and prior to joining the Pharmacy Technician Certification Board, worked at the American Pharmacists Association and also practiced in community pharmacy. Just a few housekeeping announcements to get us started. This webinar is being recorded and live streamed on Facebook. The recording will be available on our website, www.fip.org. You may ask questions throughout the presentation using the question box provided on your screen. And you are welcome to provide feedback about today's program to webinars@fip.org. I also encourage you, if you are not already, to become a member of FIP to gain access to valuable seminars, content, and resources such as today's webinar. Today, we have 4 excellent speakers, and you can see here the topics that each of them will cover. Toward the end of the presentation, we'll have plenty of time for questions from you, and then we'll close out with some final remarks and a reminder about our next digital event. Here you see the learning objectives of today's program. So at the end of the webinar, we hope that you'll be able to understand the importance of data, evidence, and research related to the role and practice of pharmacy technicians. We hope you'll learn about the many contributions of pharmacy technicians on an international level, and also be able to describe recent and upcoming publications related to pharmacy technicians. It gives me great pleasure to introduce our first speaker, Charlotte Verna Rossing. Charlotte graduated from the University of Copenhagen in 1998. In 2003, she received a PhD degree in social pharmacy with a thesis named The Practice of Pharmaceutical Care in Denmark, a Quantitative Approach. Charlotte serves as a fellow of FIP since 2020. Subsequently, Charlotte joined Mccarron, where she is the Director of Research and Development, with a special focus on development and implementation of pharmacy counseling services. Furthermore, she is responsible for the continuing education and professional development for pharmacists and pharmacy technicians in Denmark. Charlotte, welcome.
Thank you very much, and thank you for having the opportunity to talk about this research that we have done in Denmark. So I will just go straight into it. Thank you. This is all based on a paper that has been published in Pharmacy, and please feel free to go and find this paper with more details if there's something that I'm missing out in this project or in this presentation. I also like to just point out in the beginning who was the main forces of this project we did. This was made in collaboration between 3 organizations, between the associations of Danish pharmacy technicians, or pharmaconomists as they are named in Denmark, the Association of Danish Community Pharmacies, so the pharmacy owners, and Pharmacon. Pharmacon serves as the school where pharmacy technicians are trained in Denmark. So everybody comes to Pharmacon at a certain stage during their education. And additionally, we have this area in Pharmacon where I'm situated that do research and development in pharmacy practice in general, but also more and more in the role of pharmacy technicians. Next slide, please. The study I'm going to talk to you about today is a study where we wish to map the counseling activities in community pharmacies in Denmark performed by pharmacy technicians. It was important for us when we designed the study that we had a big enough program or big enough project so that we could say something about how it is in general in Denmark. And based on that, we invited 40 different community pharmacies to be part of this study. And we ended up with 76 pharmacy technicians being part of this project. These were all distributed across the regions of Denmark to make sure that we can say something in general afterwards. What we asked them to do is that we asked them to do 5 full-day registrations. So when a pharmacy technician met in the morning, they had to register everything they did during that full day. And we wanted 5 days within a 4-week period. Everything was registered electronically and afterwards was analyzed in SPSS for the results. Next slide, please. What we ended up with more than 20,000 registrations, which figured or boiled down to 17,692 customers. So the data set I'm presenting to you today is quite a big, very big data set actually, that says something about how these 76 pharmacy technicians counsel these 7,692 customers in the pharmacies. They were distributed differently, those customers. We had 10,785 customers that came to collect prescription medicines. We had 2,773 people that came to ask for OTC medicines or presented a symptom. Then we have 1,937 that came and asked for non-medical products. And then the last 2,197 customers that came into the pharmacy had a mixture of the different errands in the pharmacy. Next slide, please. And if I want to say if I should just say some general pictures, what we saw was that 58.9% of all registered patients received counseling. So when they came into the pharmacy, they received some kind of family counseling from the community at the community pharmacy by the pharmacy technicians. We had 15.8% drug-related problems were documented in all registered patients. The drug-related problems distributed across all the different groups, and I will get back to the details in those drug-related problems. Counseling by the pharmacy technicians solved partly or fully 70.4% of the patients with drug-related problems. So it was very obvious for us that they could both identify counseling areas, drug-related problems, but also solve the drug-related problems. This was all based on self-report, of course, and we asked the pharmacy technicians that were registered if they could estimate if they have saved a visit to the general practitioner. And in 25.2% of the registrations, the pharmacy technicians said they would have saved a visit to the general practitioner and thereby have saved cost for the healthcare system. Next slide, please. This is the first of the two. This is a table from the paper, and this is the first of two slides where I go a little bit more into details. On the left-hand side, you can see all the different subjects we had in our questionnaire as subjects that could be found as counseling in the pharmacy. In the first column, we have all the customers, and then in the three next columns, we have customers registered that requested a prescription, customers with OTC medicine or presenting a symptom, or customers registered only non-medical products. And as we can see, of course, because the group of patients or customers requesting a prescription, that's the largest group, then the largest numbers come from this. Next, please. So I'll just go through which ones are the most important ones. The one that you saw mostly was personal care. So counseling on how to take care of yourself and how to take care of your treatment. Next, please. The next one is adverse reactions. We have seen this also in other research, that both in the counseling with the pharmacy technicians, but also pharmacists, this is a very common area for counseling. Next, please. Then, of course, effect of the drug and product. So talking to the patient and customer about how does this drug work and how should it be used? What's the effect of it? Next, please. Drug product use. Next, please. Adherence. So whether or not the patient or customer will actually take the medication, if they have any regrets or other thoughts about how to take their medicines. This was also an area they very often talk with the customers about. Next slide. And product substitution, drug and product substitution. In Denmark, we have generic substitution. So they can, when you come into a pharmacy in Denmark, the name and the packing might change from time to time you go to the pharmacy. And of course, this is always a topic for counseling at the counter in Denmark. Yes, next, please. So now we move to the area of identified drug-related problems. So first were the areas where we found counseling for the pharmacy technicians. And now we talk about what identified drug-related problems were actually seen. The first one is others. That's not so important. Next, please. And next. The first two that is highlighted, that is actually quite big, are product or prescribed drug not available and prescription not available. This is a technical thing in Denmark. The prescription, if the patient or customer come directly from the general practitioner, the prescription might not have arrived yet in the electronic system. And because of that, the customer might go to the pharmacy without any luck and will be asked to come back to the pharmacy. The next one, product or prescribed medicines not available, shows that in some situations the drug is might not be in stock in the pharmacies. We looked into this number because we found that it might have been a little bit high, and we talked to the suppliers and also to the Association of Danish Pharmacies, and they could see that in this particular area time where we did the survey, it resembles the data from the whole pharmacy sector. So there's not a deliberate bias in it. Next, please. Adverse reactions. So side effects is one of the important things that you usually go in and counsel about. Next. Non-adherence. The same as we saw in the counseling. So it's an area for counseling, and then you find it as a drug-related problem, non-adherence. Next. Symptoms that requires a visit to the GP. So of course, some of the drug-related problems also require that they have to go to the doctor, because it's not a problem that can be solved by the pharmacy technician or any other people in the community pharmacy. Next, please. And inappropriate drug or product use. So the selected product is not the most relevant one. This is, of course, mostly in the OTC medicines. Next, please. So in conclusion, next. Pharmacy technicians contribute to medication safety in community pharmacies by counseling customers and handling drug-related problems. Next. Drug product use was the most frequent subject in counseling in the total population and in all the subgroups. So how to actually use the medicines is a very important topic to counsel the patients and customers about. Next, please. In counseling customers requiring prescription medicines, the two most frequent subjects were adverse events and effect of the drug. Next. In counseling customers requesting OTC medicines, the most frequent subject were presenting a symptom, requesting non-medical drugs, effect of the drug, and personal care. Next, please. And 25.2% of the customers receiving counseling were evaluated to have saved the visit to the general practitioner. Next, please. The most frequent drug-related problems for treating effectiveness and safety vary between the subgroups. If we look at if you first look at the group where customers requesting prescription medicines, the most important drug-related problems were adverse reaction and compliance problems. If we look at the ones having OTC medicines, the most common drug-related problems were inappropriate drug or product, symptom that requires visit to the general practitioner, and adverse reactions and duration of treatment too long. And in the last one is, of course, the one where you have maybe used OTC medicines for too long and you actually need a prescription to help your illness or sufferance. And regarding customers requesting non-medical products, the most frequent drug-related problems were inappropriate drug or product and symptoms that requires a visit to the general practitioner. So also here, there were a need for the customer to go to the general practitioners. Next, please. In conclusion, I just want to acknowledge all of the pharmacies that's on the right-hand side. It's in Denmark, in Danish, so you can see all the funny letters we have in Danish. But these are the 38 pharmacies that we had in the study. And of course, I also like to acknowledge the co-authors of this paper. Thank you very much.
Charlotte, thank you very much for sharing that excellent presentation. This is certainly interesting research, and I'm sure we'll have some questions toward the end of the presentation for you. So I am pleased to welcome our next speaker, Tamara Kuhler. As an education researcher and skilled lecturer, Tamara aims to connect everyday practice of pharmaceutical care and educational programs through innovative and timely research. Tamara is interested in changing roles of pharmacists and staff in order to tailor professional practice to good patient care. Tamara, welcome.
Thank you. Oh, I'm really looking forward to this. So good afternoon, and a big thank you to FIP and Ryan and Lynn for having me at this digital event. In the upcoming 10 minutes, I will share with you my latest research on the pharmacy technician that has to do with the barriers and facilitators that are present when implementing the profession of the pharmacy technician. And spoiler alert, it all comes down that we need to make more connections between the pharmacy technician and the team, the pharmacy technician and the pharmacist, the pharmacy technician and the mission statement of the individual pharmacy practice, and the pharmacy technician and the field of pharmacy as a whole. So this digital event is perfect. Next slide, please. But before we get into all that nitty-gritty of the research, let's try and set up some sort of a connection in this digital pixel world, you know, between you and me. I'll go first, and then when we get to the discussion part of this webinar, please introduce yourself, and so we know that who we are talking to. So as Ryan said, I'm Tamara Kuhler. I'm speaking to you from the Netherlands. I'm trained as a pharmacist, and I'm currently working as an assistant professor at one of the pharmacy faculties in the Netherlands. And I was fortunate enough to combine my love of pharmacy with my love for teaching in a PhD trajectory, which, small hooray, is nearing its finish line. I will have my defense in August. Next slide, please. So before we go on, I would like to provide you with some background to my research on pharmacy technicians. In the Netherlands, we used to have two professions in the pharmacy team. One click, please, Ryan. Yes, excellent. So we used to have the pharmacist who's trained at university level, and we used to have the pharmacy assistant who's trained at the level of vocational education. Next slide, please. But with the rise of pharmaceutical patient care, the workload of the pharmacist grew, and then the profession of the pharmacy technician was inserted to the team to support the pharmacist in all things patient care. One click, please. One more click. Oh, this is very hard to, talk and try to organize stuff with Ryan. But okay, so let's get back to the talk. So that pharmacy technician was designed in the Netherlands to sort of fill in the gap between the pharmacist and the pharmacy assistants. And in the Netherlands, pharmacy technicians are former pharmacy assistants who have received 3 years of additional training. Next slide, please. So, as with all new ideas, there's this difference between theory and practice. And that's where my research interests lie. Because how did it all work out, that pharmacy technician? This addition of a new profession to an existing team structure. So let me illustrate my point with a small part of audience participation. Perhaps you can put your answers in the chat. Because if you look at these pictures, please go one back. No, that's, yeah, okay, excellent. So if you look at these pictures, can you identify for yourself the pharmacist? These are all randomly chosen pictures of pharmacy teams in the Netherlands. And I think if you take a look, it's probably the one that has the different uniform or is not wearing the uniform, right? And 3 of them are guys. But, and Ryan already gave a little heads up, who in these pictures represent the pharmacy technician? They're not visible. You cannot recognize them. So there are no clues. And now one click, please, Ryan. Yes, because they are there. We have 4 pharmacy technicians in these pictures. Next slide, please. So the research goal and what we aimed for in the final piece of my thesis was to get insight in what factors influence, in either a positive or a negative way, the role development of the pharmacy technician in hospital and community pharmacies. Next slide. What we did was we held interviews with pharmacy technicians and 2 of their close co-workers, being a pharmacist and a pharmacy assistant. We talked about what, in their opinion and in their setting, was of influence on the role development for the pharmacy technician from an organizational, relational, and pharmaceutical care point of view. Next slide. So what we found in those interviews were 5 interrelated themes. And I will take you through them one by one, but for now, it's good to take into account that within those interrelated themes, there are 2 levels to be distinguished. First, you have the level of context. So in other words, the field of pharmacy itself, the world the pharmacy technician lives in. And the second level is more close to home and relates to the personal interactions, the day-to-day interactions within a team. Next slide, please. Okay, so for a more detailed look, we'll take the first 2 themes, the ones on the contextual levels. For the first one, participants experienced a lack of vision within the field of pharmacy on the new role. So one click, Ryan. Let me read you a quote to provide some color to this theme. Pharmacy technicians, said one of the pharmacists, have no formal roles and responsibilities, no core duties that are the same in all settings. Some pharmacists see the pharmacy technician as a kind of chief pharmacy assistant or as a replacement for a second pharmacist. However, a specific place, they don't have that. So in other words, participants seemed to struggle to understand exactly what the problem was that needed to be solved by the addition of the pharmacy technician to the team. And if you do not know what the rationale is behind this profession or how to make good use of this well-trained team member, that implementation of the role might be hampered. The second theme on the contextual level was the prevailing learning climate. I've brought you another quote to illustrate this theme. It's good for everyone, also within the pharmaceutical field, to always keep an eye out for people who can take the lead. You have to recognize those innovative people in your organization. Give them the right tools, let them learn. Because if you educate people and give them the role to implement what they have learned, then you will all move forward together. So for us, hearing this, it's easy to understand that when such a positive learning climate is present, the role development of a pharmacy technician will benefit. Next slide, please. So now for the three themes on the personal interaction level. The first one, expectations and organizational fit, relates to what the different team members, including the pharmacy technician, expect of a pharmacy technician and how they all, as individuals in that team, regard this whole process of change. One click, please. And you can imagine that the rising in the ranks of one of the former pharmacy assistants does not always work out well, with negative consequences for the next pharmacy technician. Our fourth theme that has to do with personal interactions has everything to do with the individual pharmacy technician and how they get on with developing their role. One click, please. So one of my participants in the interviews, a pharmacy technician, voiced this eloquently. She said, it's easy for me to say, I have the diploma, so treat me like a pharmacy technician. But what does it entail? What are you capable of doing? You still need to prove that. And so I show that I'm eager to learn, that I really keep my promises, and that I work hard for it. For example, I would really like to be more involved in medication reviews, because I think that I'm well trained with lots of communication training. However, this idea needs to evolve a little more, but I'll succeed. I'll slowly take it over, little by little. And the last theme that we discovered in the interview data relates to the presence of support. Support comes in two forms. It comes in the form of task delegation, which is actively handing over tasks and responsibilities from a pharmacist to a pharmacy technician. And it comes in the form of actively searching by pharmacist and the pharmacy technician for opportunities that help build up the function of the pharmacy technician. But again, just as with the other four themes, this theme also can have a positive ring to it or a negative one. As one of the interviewed pharmacists admitted, a reduction in workload, would be great, particularly in regard to medication reviews. A pharmacy technician would be tremendously good at it. They would be more structured, well prepared. And yet, I also think, it would be nice and easy, but I also get a lot of energy from conversations with patients. So it would be nice if the pharmacy technician could do it, but I also like to do it. Next slide, please. So in conclusion, I've only presented you with the bird's eye view of my data. We only got 10 minutes. But what I hope you recognize as the take-home message of today is that the role development of the pharmacy technician will spiral up if we all strive for a positive outlook on the 5 discussed themes that were recognition of the role, learning climate, organizational fit, personal traits, and last one, support. Next slide, please. So this is the end of my talk. I would love some questions and discussion since Corona basically canceled all my other opportunities to present and discuss this data. So let's circle back when we heard from all the other speakers. See you in a bit. Thank you.
Thank you so much, Tamara. I think the quotes that you shared were really interesting, and I think it really reinforces the point that a positive outlook is so important when it comes to empowering and enabling pharmacy technicians. So at this point, it gives me great pleasure to hand the program over to my colleague and co-moderator, Lynn Fogerty. Lynn has been a registered pharmacist in South Africa for 22 years, where she has worked in various sectors, including retail, primary healthcare, and wholesale pharmacy. Lynn has been involved with the training and assessment of basic and post-basic pharmacy assistants since 2007. Since 2008, she has been a lecturer at Nelson Mandela University, where she is still employed. In addition to lecturing responsibilities, she coordinates the pharmacy technician program at Nelson Mandela University. More recently, Lynn has been appointed by the South African Pharmacy Council to the task team for setting of pre-registration examinations for pharmacy support personnel and to the accreditation committee for the assessment of programs leading to a PSP qualification. She is completing her PhD, which looks at whether qualifications for PSP meet scope of practice needs in South Africa. Lynn, thank you for moderating the next part of our webinar.
Thank you so much, Ryan, for that introduction. And so far, I'm so enjoying the presentations that we've heard so far, and I'm looking to actually reading the publications. It gives me great pleasure now to introduce our next speaker, Kimberly Mccarron. Kimberly has a PharmD. She's an associate professor in the Department of Pharmacotherapy and the director of the Center for Pharmacy Practice Research at Washington State University College of Pharmacy and Pharmaceutical Sciences. Dr. Mccarron is passionate about research involving community pharmacy practice and public health. Kimberly?
Thank you, Lynn, for that kind introduction. And thank you all for the opportunity to be here today. I'm excited to share with you some work that a group of us within the Pharmacy Technician Advisory Committee have been working on, called Advancing a Global Pharmacy Support Workforce Through a Global Strategic Platform. I wanted to acknowledge my co-authors on this project. There are several of us who have been working on analyzing the information that's out there. Our goal is to produce a commentary, which I believe we are very close to publishing. So I hope that you will be able to see that in print before too much longer. Next slide, please. Thank you. So as we talk about advancing our strategic workforce, I think one of the first steps that we ran into was figuring out how to really define the pharmacy support workforce. There are labor market models that predict there's going to be a global shortage of between 12.9 and 15 million healthcare workers by 2035, depending on which model you look at. So one way to overcome this workforce challenge is to engage mid-level providers. And mid-level providers, for our purposes, are defined as health workers with 2 or 3 years of post-secondary school healthcare training who undertake the tasks typically carried out by doctors, pharmacists, or other healthcare professionals. So the pharmacy support workforce is the mid-level cadre of the global pharmacy profession, and this refers to several different names, including pharmacy technicians, pharmacy assistants, and other groups that assist in the delivery of pharmaceutical services in a variety of practice settings. The pharmacy support workforce undertake technical tasks delegated under the supervision of a pharmacist, but often performed collaboratively side by side with the pharmacist. Sorry, it's about 3 a.m. here and I'm not quite my sharpest. The pharmacy support workforce are not intended to replace pharmacists, but rather to work side by side with the pharmacist to achieve a shared goal. As clinical care providers, pharmacists worldwide need this competent, well-trained support workforce, because without the confidence to delegate many tasks to a well-trained and capable pharmacy support workforce, pharmacists and healthcare in general would be unable to fully deliver patient care that is needed. Next slide, please. So as we analyzed the information that was out there about the global pharmacy support workforce, one of the interesting things that we came across, and Lynn's very familiar with this because she and I kind of worked on this together, but that there's a huge amount of variability and from country to country, and in some cases, like the United States, within the country. So we tried to identify what are some particular areas where we can find this variation and just bring it out and to like kind of discuss that. So here are some examples. In the first one, I would call nomenclature or taxonomy. And as we've heard the two previous speakers talk about, pharmacy support workforce personnel have different roles, different names in different countries. So some places they're called a pharmacy technician. I believe in South Africa, they're a qualified pharmacist assistant, if I remember correctly. And then of course, Denmark's pharmaconomists that have done such amazing work and we've heard so much about. So that's one area. A second one is the entry-level requirements for education. So there are some countries where pharmacy technicians, for example, in the United States, you can become in some states a pharmacy technician with really no training or background. At least in the entry-level role. And then in some other countries, and like my co-speakers have already talked about, this requires a 3 or 4 year bachelor degree, and there are some countries listed as examples there. But there's a huge level of variability in terms of what is the requirement to be part of this pharmacy support workforce. Do you need to go through a training program, or is this something that's going to require years of study? Another area where we identified variability is opportunity for advancement. So in some countries, there's a huge opportunity for growth as a member of the pharmacy support workforce. And in other countries, really, we look at the pharmacy support workforce as being one role, and then the next step kind of education-wise for that would be pharmacist, which I know here in the United States is quite a big challenge. I know many phenomenal pharmacy technicians who I'm so thrilled to work with regularly, who certainly have the skills, capability, and knowledge to do much more than they're currently allowed to do. But to them, becoming a pharmacist would require 6 to 8 years of additional education, would require a doctorate degree, and either financially or lifestyle-wise, or really just personal interest, that's not a good fit for them. So that's one example. But then on the other side of the coin, there are many countries that have lots of opportunity for pharmacy technicians to move up over time by completing additional educational opportunities. So in the Philippines, for example, I was told by a co-author that initial certification and training is required, but after that entry level is completed, there's also lots of opportunity to complete some accredited modules and then to advance their career as they move forward. And then another area I wanted to highlight is regulation. So there's huge variability in terms of is the practice of the pharmacy support workforce recognized or regulated by a government body? So are there requirements for licensure, or is this someone that can work in an assistant position and not necessarily have to be registered? Are there annual fees associated with having a license, continuing education requirements? Are there rules about the scope of practice written into law? Huge variability that we see among those issues. Next slide, please, Terry Lynn. Thank you. A few more we wanted to point out. So level of oversight, I think this is a huge one because we've heard already today of some phenomenal work done by pharmaconomists, for example, and in many different countries, the pharmacy support workforce personnel have independent roles, and they don't necessarily require direct supervision by a pharmacist. Sometimes that person could be working in the same area but independently. Sometimes they're working remotely. It is entirely dependent on what country you're from and what the rules are. Here in the United States, technicians do take on many advanced roles and have lots of opportunity to learn new things, but they're still, this recognized as a pharmacy technician, which is a role that always requires pharmacist supervision, even though we have many phenomenal technicians who, as I said, do such great work, and I would certainly trust to be able to delegate those tasks too. So another area, as I just mentioned, are tasks that can be delegated. So in some countries, the pharmacy support workforce personnel are doing many advanced roles like internal product verification, immunizations, or conducting medication reconciliation, which I think is called different things depending on where you live, but interviewing a patient to analyze what medications the patient believes they're on and what medications our medical record says that they're taking, and identify where there are gaps in that. It's definitely a task that can be very appropriate for someone from the pharmacy support workforce, but it depends on what country you live in. And then the last one I wanted to talk about was really just recognition of the profession as a profession. It sounds like there are still several countries where they either are currently still working to identify a pharmacy support workforce role that is recognized and therefore also regulated by the government. And in some places that is well established and has been for a long time. There are certainly countries that also just don't acknowledge other cadres besides the pharmacist as personnel working in the pharmacies. And this can occur for a variety of reasons as we've identified, but certainly adds to that global variability. Next slide, please. So where do we go from here? So in order to produce real substantial advancement of the roles and recognition of the pharmacy support workforce, we really need some global collaboration. FIP is one of the organizations that's working to unite global efforts in this area, as you can see by our group here today. So addressing this healthcare workforce crisis that I was speaking about earlier is going to take a strong global effort, and it's not going to be a short project. It's going to be a substantial period of time. So as these PSW roles or pharmacy support workforce roles continue to evolve in many countries in response to the need for more healthcare providers, we all must collaborate to make that happen. Additionally, systems within countries as well as collaboratively globally. Within countries, we also need to flex on our concepts, knowing that individual nations, different populations, particularly such variability in our healthcare systems in general, the number of available workers and the challenges faced by particular vulnerable populations in particular countries are just, there's vast variation in that. So working together, we must address the lingering problems that have continued to kind of plague development and recognition of these pharmacy support workforce cadres. Continuing to develop and support our mid-level pharmacy workforce will increase the likelihood of success. So I hope this was helpful to just get a brief overview of some of the challenges and hopefully also opportunities for us all to advance the pharmacy support workforce together. And I look forward to your questions and comments about this when we get to the later portion of the program.
Thank you so much, Kim. That was such an eloquent summary of this commentary that we have been working on, and I really think highlights the need for more research into the area of pharmacy technicians globally. And so that brings me to our next speaker, Michael. Michael, I'm not sure if I'm going to pronounce your surname correctly. Michael, you can correct me just now. Michael Mungoma. And Michael is a pharmacist and toxicologist with a bachelor's degree in pharmacy from Pakistan and a master's degree in toxicology from Ireland. Michael works at Mount Kenya University as the Dean of the School of Pharmacy, and he is also the chair of the Education Committee of the Pharmaceutical Society of Kenya and the editor of the Pharmaceutical Journal of Kenya. Welcome, Michael, and we look forward to hearing your presentation.
Thank you so much, Lynn, for that introduction. I also want to thank everyone who made this digital event. Before I start, I just want to make a disclaimer that the information I want to provide in the presentation is a general background of the pharmacy workforce in Africa, and that the information is a summary, it's in summary form and does not purport to be complete. Next. So I did a little bit of background checks on several countries in Africa and brought out some information regarding the pharmacy workforce and the different definitions, as well as the differences in between the countries in terms of what they contribute towards the pharmaceutical sector. So I'll just start with a few definitions. Pharmacy technician from the Pharmacy Technician Certification Board defines the technician as an individual working in a pharmacy who, under the supervision of a licensed pharmacist, assists in pharmacy activities that do not require the professional judgment of a pharmacist. So they help relieve the manpower shortage and allow pharmacists to focus on direct patient care. In Ghana, the definition is slightly different. Someone who works under the direct supervision of a licensed pharmacist to process prescriptions, dispense medicine, perform pharmacy-related functions, and provide information to customers. Next. So in these two countries, they had a slightly different definition and even a title for, especially for Ethiopia. In Zimbabwe, again, the technician is registered and licensed professional. So that's slightly different as compared to the previous two definitions. Who is trained in providing pharmaceutical care in various health provision settings and works in collaboration with other regulated health professionals. So in a sense, they are independent professionals and work independently and work together with other professionals in the healthcare sector to provide pharmaceutical care. In Ethiopia, they have druggists and rural drug vendors, well, in addition to pharmacists. So these two cadres work in a drug store, which is a drug shop, but the medicine to be dispensed, again, is limited. And that means it is not legal to hold every medications in this medicine retail outlet. For instance, it's not allowed to hold medications like psychotropics or other controlled medicines. Next. In South Africa, they have, in addition to pharmacy technicians, they also have pharmacist assistants, post-basic. And these have undergone formal basic and post-basic training and who are registered with the South African Pharmacy Council. So there's a bit of structure there, and certificate of qualification obtained in South Africa from a provider of education and training approved by the South African Pharmacy Council. Next. So again, the training background of the support workforce in the different countries that I sampled. In Ghana, to apply for a course, you need to be working in a pharmacy. So that's something very interesting, that you need to be already in a work setting, and training can take place between 6 months to 1 year. But if you're going to get a diploma, that would take more than 2 years, and there will be a bit more time spent in class as compared to your workstation. In Kenya, where I come from or where I work, we have a diploma in pharmacy or a diploma in pharmaceutical technology. That usually takes about 3 years before enrollment to a board, so our regulator, Pharmacy and Poisons Board, and their pre-registration examinations. So in community settings, the pharmaceutical technology is often practiced without direct supervision of a pharmacist. So again, they work independently. That's quite similar to the situation in Zimbabwe. Running dispensing outlets after meeting the regulatory requirements. Next. So the scope, just a little bit of the scope of work and regulation. So pharmacy technicians, according to the South African Pharmacy Council, I just picked a little bit, they're allowed to sell Schedule 1 and Schedule 2 medicines without prescription from an authorized prescriber, dispensing of Schedule 1, 2, and 3, and 4 medicines or scheduled substances, provided that the pharmacist interprets and evaluates the prescription. So the role of the pharmacist here is coming out quite significantly. The pharmacy assistants act under the direct personal supervision of a pharmacist in a pharmacy. Next. So certain country experiences. I picked Ethiopia. And so even though the Pharmacies and Drugs Proclamation 1942 was used to regulate both the professions, and we're talking about pharmacists as well as the other cadres that I mentioned there, including druggists, and the facilities where they were practiced. Comprehensive regulation of the pharmaceutical market was introduced in 1964 by that regulation. So the legislation formed the legal basis for official establishment of drug regulation in the history of Ethiopia, enabling the regulation of the practice of pharmacists, druggists, and pharmacy technicians. So it's interesting that they have the three distinct cadres mentioned there, even in legislation. Next. In Madagascar, the pharmacist is ultimately responsible for the technicians, has at least 7 years of education and training, so the PharmD, and the pharmacy technician has as much lower degree of responsibility, no standardized required education and training. In Seychelles, in fact, they have still people being trained in certificate courses in pharmaceutical dispensing, but they also have pharmaceutical technicians who have diploma qualifications. So in Ethiopia, the professional who is supposed to dispense inside the drugstore is a druggist. All licensing and standard and setting standard is similar with the pharmacy. Next. In Egypt, there was an institute almost 50 years ago educating pharmacy technicians, but a few years back, through their trade union, a number of technicians use these trade unions to forward their claims as well as their recognition, because a lot of things changed over time and recognition became an issue. So the union provides humble courses for subscribed technicians. So although pharmacies hire technicians and let them deal with medications, their role is not clear and they do not have specialized educational programs. Legal responsibility falls on the pharmacist. Next. So from some of these that I sample, I realized that there's a need for harmonization. Yeah, so there's a need to look at the differences in supervision requirement, education systems, where they enter and how long they need to be trained or what sort of skills that are actually required for harmonization. Then supportive legislation for pharmacy support workforce is actually needed and clearly stipulated so that the pharmacy workforce is entrenched and is clearly defined. And another need for harmonization is, of course, a shortage of the pharmacy support workforce in certain countries. Regional diversity, we have diverse requirements, diverse legislation, diverse populations, as well as needs. And then conflicts of interest where there's no legally endorsed scope of practice. So the scope of practice, again, is something that we probably need to look into. And I'm happy that FIP is also looking into that, as well as competency frameworks for the different cadres for the pharmacy support workforce that is really needed. Next. So some of the benefits of this harmonization would include increased access to pharmaceutical services and products from known and regulated persons, and new job opportunities, whether it is in country or even across borders, agreed and documented competency frameworks, then a strengthened pharmacy workforce. Yeah, so we need the numbers as well as the skills and the ability of people and individuals as well as structures to ensure that the pharmaceutical services are provided, and establish national and regional capacities in the pharmacy workforce. Next. Yeah, so in summary, I just want to say that the pharmacy support workforce is vital for provision of pharmaceutical services. Variation within countries on education expectations and regulation of pharmacy workforce is something that we need to highlight. Inadequate number of practicing pharmacies and training institutions is also driving this expanded pharmacy workforce. Urgent need for harmonization of the pharmacy support workforce to reap full benefits of an integrated system. Next. those are just some of the references for what I've just made in my presentation. And I want to thank you all. Thank you, Terry, Lynn, for this opportunity. Thank you so much.
Thank you so much, Michael, for that presentation. And it really, you've already made mention of the competency framework. And so your presentation really does lead into just mentioning that that is one of the projects that the advisory committee is working on, is this competency framework that sets out and defines each individual competency required by pharmacy support personnel within the organization in which they're working. And then in addition to the competency framework, we're also working on a glossary project, again, just speaking to harmonization. So that really, your presentation just emphasizes that the projects that we are busy with as an advisory committee are relevant and very necessary in this emerging research area in terms of pharmacy technicians. So that takes us to the point of questions and answers, and we still have quite a few minutes. And so I think we can get through most of our questions. So I'm going to start then with Charlotte. Charlotte, are you with us there?
Yes. Yes, I am.
Charlotte, what, if anything, can you tell us about what customers or patients think about receiving counseling from pharmacy technicians versus from another healthcare professional? Do you think they perceive that counseling differently?
We don't have data in Denmark on it, so it has to be based on my experience and my perception. We haven't actually. We did a similar survey as of this one I reported with both pharmacists and pharmacy technicians back in 2011, but we never, cross-checked the two professions towards each other. When you walk into a Danish community pharmacy, I would say there is a very, very big chance that you only meet the pharmacy technician. They are the main people at the counter in Denmark. They are the trained profession for counseling in the pharmacies in Denmark. And I would also say that I've heard many pharmacists saying this and acknowledging these skills, that the counseling of patients is often very strong with the pharmacy technicians because they are explicitly trained in it all the way through their education, because they have so much time in the pharmacies and are trained there. So they find it very relevant within the pharmacy. When we talk about the patients, I think in Denmark, we have a very long tradition of having pharmacy technicians or pharmaconomists very close to the counseling and the core task in the pharmacies. And the patient feel that it's very good and relevant counseling they get. And of course, then sometimes they get a question that they cannot answer for some or another reason, and then they get their colleague to help them and assist them in these questions. Did that answer your question?
It does answer my question, and again, just emphasizes another area of research that can be done. Just adding on that, do you have anything that's in progress in terms of research projects or anything that you are wanting to do in terms of research projects that you can share with us today?
Yeah, what we're doing in Denmark right now, because we can see this is such an emerging area. So we actually have two legs, or what would you say? We work in two directions. The one direction we are working in is to use the pharmacy technicians while they're students as data collectors, and putting the knowledge that they gain from collecting data on patients that might be on compliance or beliefs about medicines or whatever, and feeding that back to them in the teaching situation. So we have a lot of focus on how to support the pharmacy technicians and how to gain knowledge through performing research, and we actually also publish this work. So that's one area, and another area we're working in is also, I can't be more specific, but we're working in the area of the role of the pharmacy technician or pharmaconomist in the longer run in Denmark also, and hopefully very soon I can be more concrete.
Ryan?
Thank you, Terry Lynn. So I think our next question would be for Tamara, which there's one here that came through. And what percentage of pharmacies in the Netherlands employ pharmacy technicians?
Oh, good one. I have to estimate that. I think right now in the Netherlands, we have approximately 700 graduated pharmacy technicians. And I think 1 in every 4 or 5 pharmacies in the Netherlands, so community pharmacies, outpatient pharmacies, hospital pharmacies, will have a pharmacy technician. But that doesn't necessarily say that all involvement of pharmacy technicians or the role they play in those pharmacies is equal. Sometimes they only have a small percentage of their workload to be a pharmacy technician, and the rest of the week they work as a pharmacy assistant. And in some places they're 100% pharmacy technician, so Monday to Friday.
Thank you. As a follow-up to your presentation with your research, what do you think is the impact of research like yours on the global pharmacy support workforce and pharmacy technicians in general?
Oh, I thought you were aiming for the Dutch pharmacy support workforce, and then you mentioned global. Global, I'm not sure, because I see how much trouble it takes me to, sort of get my research data out into the Dutch pharmacy practice. So I do that by, giving interviews and teaching courses at the pharmacy technician program. But the global setting, I think digital events like this will help. I love to present at the Pharmacy Technician Symposium because I found sort of, like-minded spirits over there who want to develop the function. I always find it hard to, you can publish research, but I always wonder who will read this? Where does it end up? Does it end up with the pharmacy technician somewhere in the pharmacy? How does my research get to that person? So impact, I'm not sure.
Well, I think it's like you said, it's always good to be able to just share these ideas with people around the globe to hopefully spark their own ideas about maybe research that applies in their country. So thank you. Terry Lynn?
Thank you. Kim, that brings us to you. I see you've already answered one of the questions in the chat box, and successfully, I think that did close that question. But maybe you can just share with us one of your favorite examples of where you've seen pharmacy support personnel working alongside pharmacists to achieve a common goal.
Yeah, I'd be glad to. And so maybe some of you know already, but my specific area of interest has really been around technicians administering immunizations, which is extremely new in the United States. I think in Denmark, you've been doing that for a little while. We're slower to get this started. But I would say COVID-19 has created a lot of opportunities for advancement in a way that I've never seen, since I've been doing this. But my favorite example certainly stems from that. My background is as a community pharmacist. I worked for a pharmacy chain right out of graduation from pharmacy school here at WSU. And at that time, I worked with technicians who I just thought were great. They were so good at what they did. And in the United States, they're extremely limited in what they are allowed to do. They're able to do so much more than we allow them to do. And so it really got me thinking, as a pharmacist, I'm completely overwhelmed and overburdened nearly every day, checking hundreds of prescriptions and doing transfers, counseling, immunizations. And I have these technicians who are great and who are not being utilized, you know, to their full capacity, I guess, to their, and I think it stems back to their interests too. I think a lot of them are getting, you know, there's a little bit of boredom, at least with the ones I work at, because they're doing the same things. And so to be able to, one, solve the issues with the pharmacists being burned out and overworked a lot of time, and engage the technicians in something that I think they really want. You know, it's that advancement of being able to do something new and interesting. I just loved having been a part of that for the last couple of years. I don't really do a lot of social media, but I had a friend text me last week and say, I saw this on Twitter, and it was pharmacy technicians in the United States working for some large chains saying, you know, Walgreens just paid me $1,000 to learn to immunize, which makes me so happy, because one of my other concerns was, are technicians being compensated for these advanced roles, or are they being given more tasks to do without additional support or appreciation? So to see that technician say, you know, I was paid $1,000 to go through immunization training, probably I wrote a training that is now used by the American Pharmacists Association that I know that company uses. So thinking about that, and then seeing several technicians respond saying, you know, I didn't get a bonus for the training, but I got a $2 an hour raise, or technicians getting a signing bonus to start having committed to learn to immunize, just makes me so happy to see this advance. And in something that's been such a negative, awful year in so many ways, to see something positive come from it is really encouraging.
That's fantastic. So we did have a comment earlier on in the chat box just about the fact that all our panelists are pharmacists, that we don't have any representation from pharmacy technicians. Maybe you can give us some advice in terms of how pharmacy technicians can get involved in pharmacy technician related research.
Yeah, I thought that was a great question, and is a bit complex to answer, I suppose, too. But I agree. You know, I think is kind of my response that I'd love to see more pharmacy technicians engaged in pharmacy technician related research. At least in the U.S., most of the people doing research in this space are pharmacists, and most of them are either from academia or like Ryan, you know, or with a nationally recognized organization that supports technicians. So I'd love to see more research coming, you know, from technicians and getting ideas from their wealth of experience that they would have to share on that. For people who are interested in advancing that, and there again, I can only speak to my own experience here in the US, but my first thought would be reaching out to those in academia, anybody you know, or through a local organization, or through maybe the school that you went to become a technician. I think there are a lot of people who are interested in engaging the technicians more as being part of the research team. At least where we are, most of the research though is coming out of like PharmD institutions. And less, I find that faculty through the technician programs, at least here in the US, many of which are like it through a community college, those faculty are more focused on teaching and don't have a research component to their job, which at least here seems like it's maybe part of the issue. I don't know about elsewhere, but I would say if you're interested, dig in, because we'd love to have more researchers who have that knowledge and background as technicians.
Thank you so much. Ryan?
Thank you, Terry Lynn. And Charlotte, did you have something you wanted to add to what Kim said? I see you have your hand raised before we move on to Michael.
Just if there's time for it, I just wanted to add a comment on that. Yeah, I totally agree. And I can see a shift over these years. Of course, we are working, it's an emerging research area, and I think that's very important to understand. In Denmark, what we see, we have a lot of pharmacy technicians participating in the projects. And if it's possible at all, for them to represent their results on FIP conferences, on posters, or they always go. We always have quite a big delegation from Denmark. And what we also can see is that we have established a few years back now a network for the development of community pharmacy. And we start to see projects emerging from pharmacy technicians in the pharmacy. And then we support them in, you know, the structure of the research, but they basically do the research themselves. And that's both very nice for them as professional individuals, and it also gets research out there. So I can only encourage I know in Holland you have the upper network, you also have a similar network in the development of pharmacy practice, and get the pharmacy technicians in there. There's so many good ideas and power to run the projects.
Thank you for adding on to that, Charlotte. I appreciate it. So, Michael, we have a few questions for you. The first one comes from the chat here, which is, do you have any platforms from either the public or private sector that provide opportunity to the pharmacy technicians to do research work?
Thank you so much for that question. Yes, I know with a few countries that I know in East Africa, there are platforms, including social media, where pharmacy technicians would share and would share experiences as well as develop opportunities for doing research. I also know from my own experience in Kenya, the associations are quite strong. We have platforms that have already been accredited by the regulator, and in these platforms, the pharmacy technicians can actually organize, well, for now because of the pandemic, webinars, but actually conferences that are webinars where they can share a lot of their research. I have supervised a few technicians now that I'm in academia. Previously, I used to be in community pharmacy before I joined academia, but I have supervised a few pharmacy technicians, and we have had quite a few even publications in the local journals from pharmacy technicians carrying out research locally. So I think there's quite a big opportunity there. The pharmacy technicians in Africa are quite active. You know, one thing that I want to say is that the first point of call of many patients or many clients when they feel unwell would be the pharmacy. And before they actually get to the pharmacist, they would interact with the pharmacy technicians first. So that gives them quite a bit of, you know, exposure in terms of what is actually out there, and actually infuses ideas into areas where they would want to expand or look into while thinking about research. Thank you.
Thank you, Michael. And I think that's a great point, that pharmacy technicians are often the first point of contact for a lot of people who walk into a community pharmacy. So another question for you is, we've talked a lot about various research here today, and you mentioned in your presentation the need to harmonize. And so I'm wondering, from your perspective, how do you think this research contributes to that movement toward harmonization?
Well, based on just the few presentations that we've had, it brings out the critical role of the pharmacy technicians in the wider context of the pharmacy workforce. So this provides a basis just to reiterate the point that we need to clearly define who the pharmacy technician is, or the various cadres. And part of harmonization would also include maybe just having very particular backgrounds or skills among these individuals that would contribute to very specific, whether it's expectations in a pharmacy workspace. I feel that the regulators in the different countries, if they have access to some of these information of some of these publications that are being churned out from the research, then they would be able to revise some of the rules and regulations, as well as the definitions or descriptions of the wider pharmacy workforce. And that would create, an opportunity or platform to harmonize what is expected of the pharmacy technicians. Yeah.
Thank you, Michael. Lynn?
Thank you so much. Yes, just maybe some background in terms of the advisory committee itself. The advisory committee was launched at the FIP Congress in Abu Dhabi in 2019. and is comprised of FIP stakeholders together with other influential external organizations and individuals. And we have, over the last 2 years, established 4 work streams to support the goal to provide guidance and advice for leadership activities associated with the global development of pharmacy support workforce integrated with the FIP workforce missions. So, you know, there's some comments coming through of people really seemingly wanting to get more involved in some of the work of FIP. And so we really do encourage you to, through the website, which Ryan did provide earlier on, just to be in contact. And if you do want to get involved in any of our projects. Just to also say, one of our other projects, not specifically related to this particular task team, but one of our other projects is setting up a website specifically for the advisory committee. And so that's something you can look forward to in the next few months as well. So then just leaves me to thank our speakers. Thank you for your time and your expertise. Thank you for sharing with us, Kimberly, you especially. It's going to be a particularly long day for you, but we just thank everyone for just sharing their wisdom with us, and we really look forward to, in a few months' time, having another webinar presenting further research in terms of pharmacy technicians. We acknowledge, all of us here, we acknowledge the essential role that the support workforce plays in elevating the role of pharmacy and serving communities. So thank you very much. Thank you for all our attendees as well. We've had a wonderful response, and we really hope to see you at our next webinar, which is on the 14th of July. So please diarize that, and we will then be able to hear more inspiring examples from colleagues who are making a difference in their patients' lives in different parts of the globe. So thank you. Thank you everyone for attending.
Thank you.